Mr. Abdul Samad.
Madam Deputy Speaker, as a union leader and representative of fellow workers, I rise in support of this motion to drive towards healthier Singapore. This motion clearly emphasizes the need for and importance of living healthily to start at a young age. This will then pave the way for healthy daily living and mobility as we grow old to enjoy the fruits of our hard work during our early age. Furthermore, unions also want to ensure that our fellow workers can continue working beyond the retirement age, knowing that one of the criteria is about medical condition of the worker. My speech today will cover the role of unions in strongly focusing on preventive care and building strong partnerships with community partners to support our fellow workers who are taking care of their own health and wellness. Madam, I'm not sure how many in this House or members of public know the complete suite of benefits our unions provide in supporting our fellow workers. While many may be aware of the workplace grievances handled and social benefits provided by our NTUC social enterprises and affiliated merchants, unions do so much more than that. Of the many cases that unions handle, about only 10% are workplace grievances. Hence, we need to provide unique value-add service to the remaining 90% of our members, one of which is providing support and subsidy for our members in terms of health and wellness. Unions continuously innovate to serve our members better because for the unions, members first, workers always. Allow me to enlighten the House on the 3 different ways that our unions and our leaders have supported members and workers in the preventive healthcare journey. This role is not new to the unions. Minimally, we encourage our management partners to provide regular complementary health screening for our members and workers. Regular health screening is critical to identify any symptoms of sickness that each worker has and could then be provided with the necessary early intervention. Measures before the sickness gets worsened. While providing these complementary health screenings looks simple, mobilizing and encouraging workers to take part is never an easy task. There were at times when some management partners wanted to discontinue this due to the low take-up rates. But our union leaders rejected strongly and worked with management partners to maximize outreach efforts to increase and optimize participation. Allow me to share some examples of 2 unions that have gone beyond what their management partners do for their workers. First is the Union of Security Employees, in short, USE, which has set up a healthcare advisory booth provided by Health Promotion Board at their customer service center for any members to walk in and request for assistance. These members take the opportunity to know and understand health advisories while waiting for their turn to be called up. Another example is one of mine, Union of Power and Gas Employee, in short, UPH. We started this movement many years ago with one of our management partners. Initially, our members were offered $50 if they have chose not to take any medical leave for the year. We have replaced that with an annual health screening worth close to $150. We are happy to share that most of our represented companies today provide basic complementary health screening for our workers, either at their workplace or at designated healthcare or medical center, to provide that flexibility for the workers. In addition to this, UPH started to provide additional subsidy since 2018 to encourage our members to go for additional testing during the health screening. The subsidy ranges from $50 to $100 per member, depending on the cost of additional tests that our members would like to take. We are pleased to share that we have supported more than 2,200 members with a total of subsidy of more than $150,000 as of today, and we intend to reach out to more members. We are only able to do this because of our close partner, strong support and generosity for workers in the power sector. Please note that this subsidy applies for UPage members only, not for all. With so many support measures and subsidy provisions, I always believe that the union membership fee would be beneficial to all, if not many. Hence, I would call on the ministry to acknowledge and work together with the labour movement and our affiliated unions as one of your community partners to reach out, engage, and encourage our fellow workers to strive for a healthy lifestyle. This will then align with the government's vision of healthier Singapore. At this juncture, I would like to put forward 4 requests to the ministry. First, can the ministry provide a guide to the kind of medical checks that everyone should prioritize for their own well-being at different age groups? Next, can the ministry provide more designated centres for our fellow Singaporeans to do their health screening? Can the ministry also allow an individual to use their MediSave for additional medical checks that they want to do for their own well-being? And finally, can the ministry provide an enhanced infographic that not only states the risks of poor health, but one that instills the importance of starting a healthy lifestyle at a very young age? Madam, I will speak in Malay. Usul yang mengajak kita menuju ke arah masyarakat yang menjalani kehidupan lebih sihat adalah sesuatu yang wajar. Ini demi kehidupan yang lebih baik berbanding keadaan di mana kita yang terpaksa mengalami kesakitan, tidak kira golongan muda maupun yang berusia senja. Salah satu cabaran masyarakat kita adalah masalah penyakit kencing manis dan berat badan yang berlebihan macam diri saya juga, yang boleh membawa kepada pelbagai macam penyakit yang lain. Namun, ini harus diubah dari awal. Tabiat makan yang selalu mahukan minuman yang manis dan makanan yang berlemak haruslah kita tukar dengan pelan-pelan agar kita memilih minuman yang kurang manisnya dan makanan yang sihat serta dikurangkan jumlahnya. Saya sendiri menyaksikan ahli keluarga, sanak saudara dan sahabat handai yang terpaksa menanggung sakit pada usia muda seawal 30-an. Menghidapi pelbagai penyakit seperti diabetes, darah tinggi dan sebagainya. Memang ada pepatah Arab yang menyatakan bahawa setiap penyakit ada obatnya kecuali maut. Namun, itu tidak bererti kita harus membiarkan diri kita sehingga ditimpa penyakit barulah kita nak berobat. Memang amat mencabar untuk mengubah cara pemakanan kita yang kurang sihat kepada sesuatu yang sihat. Namun, kita harus akur bahawa perubahan ini adalah untuk kebaikan kita sendiri. Kita juga tidak mahu menyusahkan anak-anak kita apabila kita di usia senja kelak, di mana mereka harus menjaga ibu bapa yang sakit dan susah untuk mengendalikan kehidupan sendiri. Biarlah usia senja kita dipenuhi dengan aktiviti sehat, seperti bermain-main dengan cucu dan menjaga mereka, dapat berjalan ke masjid dan sebagainya. Ini semua hanya dapat kita raih dengan memastikan kehidupan sihat dari usia yang muda. Memang ajal tidak mengira usia, kan tetapi badan dan minda yang sihat, yang akan cergas itu lebih berfaedah buat kita. Janganlah kita serahkan kepada takdir, keadaan usia senja kita, tapi sebaliknya kita pastikan diri kita sentiasa kekal sihat demi kebaikan kita dan orang-orang yang tersayang. Madam, many of us will acknowledge that good health is the real wealth. It is one that we can enjoy benefits of our hard work instead of sacrificing our savings and wealth to pay for our medical costs. Let us work together to eat healthier food and adopt a healthy lifestyle so that we can all achieve our mission towards a healthier Singapore. In conclusion, I support this motion.